do a musculoskeletal exam. So first I'm going to take you through the range of motion of your shoulder. Can you do flexion for me all the way above and drop them back, extension as far as you can go. And then we're going to do abduction with your arms and down. And then bring your right arm across your chest, adduction. This is also the crossover test, testing for any acromioclavicular joint problems. And adduction of the left arm. Good. And then I want you to bring your hands to the back of your neck. This is external rotation. And then down and try and touch your shoulder blades. And this is internal rotation. Good. Now I'm going to have you do elbow range of motion. So flexion, extension, supination, and pronation. Good. And then I would test Finkelstein's test, so make a fist with your thumb in it, and I'm going to apply some pressure. If there's pain, that test for de Quervain's tenosynovitis. For carpal tunnel, I would do Tinel's test, where I try and tap on the median nerve. Any pain there? No. And then take your hands and do this for me, and flip them down. This is Phelan's. Push your hands together. And I would have her hold it for 60 seconds. Any pain there would be a sign of carpal tunnel syndrome. So you can relax. Now I'm going to have you face the back. And I'm going to do Neer's sign. I'm going to press your scapula forward and raise your arm up and down. Any pain with that would be a rotator cuff injury. And then we are going to do the drop arm test, so abduct your arms and slowly bring them down to your side. Okay, good. And someone with a rotator cuff injury would not be able to perform that. And go ahead and turn back to the front. And this is the Hawkins maneuver. This is for rotator cuff injury here, so any pain with that would be a positive sign for a rotator cuff tear. Now I'm going to do range of motion of your spine. Can you bend forward and touch your toes? Good, and up. And try and lean backwards. Good, and then we're going to do some lateral bending to the right and up, left, and then twisting, right, and left. And then we'll do range of motion of your neck. So flex forward, tuck your chin to your chest, and look up to the ceiling. And then lateral bending, right ear to right shoulder, left ear to left shoulder. And then turning right and left. Okay, good. Now I'm going to have you sit down, lay back on the bed. And we're going to go through some knee maneuvers here. So what I'm going to do is have you bend your knee up. I'm going to sit on it here. This is the anterior drawer sign. This tests for ACL injury. Trying to displace that. And then the posterior drawer sign tests for any PCL injury. Then I would do the Lockman's test, where I would bring your leg up to about a 15-20 degree angle and try and displace the tibia forward. If there's any laxity there, that could be an ACL tear. Now we're going to do McMurray's. So I'm going to bring your leg up, and I'm going to internally rotate, apply valgus pressure, straighten, and then up, externally rotate, apply some varus pressure, and straighten. Any pain?
No.
Okay. That's testing for a medial or lateral cruciate ligament tear. Then I would test for the bulge sign. So what I would do, this test for any effusion, is compress down and lateral and then tap. And if I would see any waves here, that would be an effusion of the knee. And that is it for the musculoskeletal exam.